Hello everyone, I'm Chandrasekhar Agrawal and I'm one of the internal medicine resident at White River Health, Batesville, Arkansas. The topic of my presentation is Shewanella putrefaciens, an unexpected threat in liver cirrhosis patients. My mentor is Dr. Kalyan Gonugunta, who is an internal medicine physician at White River Health, Batesville, Arkansas. Shewanella species, as we are aware, it is commonly found in seawater. It has saprophytic bacteria and can cause severe infections of almost any system, including sepsis. It may involve CNS. It may involve It may lead to chest infections. It may lead to cardiovascular diseases. It may lead to intra-abdominal infections. It may lead to skin and soft tissue infections, bone arthropathy, and whatnot. It especially happens in individuals with liver cirrhosis or cancers or patients who are in extremes of age, such as older adults. So the report which we have, it details a case involving a 70-year-old man with the liver cirrhosis who developed sepsis from Shewanella infection. While these bacteria typically respond to common antibiotics, there has been a trend in increasing resistance to commonly used antibiotics that makes it challenging and difficult. Coming to our case, the patient was a 70-year-old man with a medical history of hepatitis B, non alcoholic chronic liver disease, and it was classified as childpox class C. It presented to the ER with a 2 week history of decreased urine output, a few days of abdominal pain, and worsening shortness of breath over the past month. It was so severe that it necessitated the use of his wife's oxygen supply while the patient didn't used to be on oxygen at the baseline. His wife reported that he had gained about 35 pounds in past month and had multiple recent hospital admissions. On examination, patient was having signs of sepsis and he received inotropic support in the ER, was stabilized and then admitted to the hospital. An echocardiogram was performed which suggested a normal ejection fraction and was negative for valvular vegetations. Blood cultures were done and it identified Shewanella putrefaciens, while urine uh, and ascitic fluid culture were negative. There was no evidence of spontaneous bacterial peritonitis in the ascitic fluid. The patient was started on targeted antibiotics based on the culture results. However, the patient and his family opted for hospice care and eventually passed away during his hospitalization. So, what do we conclude from here? There have been several studies which have shown that Shewanella species is a cause of bacteremia in liver cirrhosis patients, and it requires early identification and appropriate antibiotic treatment to prevent severe outcomes. Now, due to rise in carbapenem resistance, medical practitioners should refrain from empirically using potent antibiotics unless necessary. So, Schwanella infections are linked to marine environments and they're more common in individuals with underlying conditions like hepatobiliary diseases, cancers. So, considering the link to aquatic settings and significant risk factors such as consuming raw fish, patients with these risk factors should be advised to avoid seafood consumption and trips to marine moderate and warm climates. Thank you very much for listening. This is what I have. Have a great day ahead. Thank you.